Kawasaki disease is a fancy term for a disease, even though which is rare in children, can cause serious heart defects and even death. Let us see about Kawasaki disease in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related, medicine related explanations are provided via videos which are released every week. If you want to see such videos, kindly subscribe to this channel. Also, if you have any queries which need to be clarified, any diseases which you need an explanation for, you can kindly mention in the comments below. Even Kawasaki disease was asked for by a viewer, which I am explaining it today. Kawasaki disease, as the name suggests, is the name given by a Japanese researcher. This disease is more in Japanese origin, in people of Japanese descent, but this is also present throughout the world. This affects usually children between 1 to 5 years of age, but even infants, that is less than 1 year, as well as older children and adolescents can also be affected. This has a slightly higher incidence in males compared to females. This disease is a disease, even though it starts with simply fever, is a disease which can involve blood vessels, which can damage blood vessels. This is called a medium vessel vasculitis, meaning not large blood vessels nor very small blood vessels, but medium sized blood vessels, like the blood vessels supplying the heart itself, which are called coronary arteries, which may be involved and can get dangerous complications. So what is it due to? The exact incidence and the exact etiology, the cause for this is not very clear, but the idea is this disease follows a simple infection. This is a response to a simple infection, probably a viral infection. Your immune system gets overactivated and results in damage to these blood vessels. Okay, what are the symptoms of this disease? So to start with, a child starts having fever. It may be of high grade in origin, sometimes may not respond to simple antipyretics. But with fever, you also get other symptoms like conjunctival redness, redness of the eyes. You may not have some discharge from the eyes, but you can still have redness. The redness can also be present over the skin. You can have rashes. So this rash sometimes may mimic simple measles like illness. So parents may ignore this, but don't ignore. Along with rashes, you may also have redness of the mucous membranes, meaning redness of the lips as well as of the tongue. The tongue may become so red that it is called a strawberry tongue. The lips may become red, dry and cracked. You may also have skin peeling around the fingernails called periungual desquamation, and also have lymph node enlargement or lymphadenopathy or lymphadenitis. So all these are symptoms of the disease, but the more dangerous problems, that is destruction and damage to the blood vessels, happens 1 to 4 weeks following this illness, and it starts with damage to the blood vessels supplying the heart, that is the coronary arteries. They may get damaged, they may get dilated, become enlarged. There may be outpouchings called aneurysms which are formed. The blood may get clot. This can result in heart attack and even in sudden death. The other layers of the heart may also be affected, and other organs like brain, eyes, liver, they can also be affected by Kawasaki disease. Especially these complications involving the heart and other organs develop if this illness is not diagnosed and treated within the first 7 to 10 days of illness. The treatment must be started immediately. Can you diagnose Kawasaki disease? Yes, there is no single test to diagnose Kawasaki disease, but there is an established set of criteria by which this disease can be diagnosed. So if we visit the doctor at the earliest, especially even after 5 days, if the fever is persisting, doctors may do tests as well as ECG, echocardiogram, other blood tests to identify this disease by following the set criteria. And if this disease is identified, you have to start the treatment immediately. By starting the treatment immediately before 7 to 10 days, we will be able to prevent the complications involving the heart. But if it is left untreated, this can result even in sudden death. And especially even if the heart related complications seemingly don't cause immediate disease, it can result in heart attack as a young adult or an adolescent. So this risk can be there for a long duration. So treatment and diagnosis at the appropriate time is of utmost importance. As I said, a definite treatment is available in the form of intravenous immunoglobulins and usage of aspirin. And aspirin may need to be continued for 2 to 3 months. Sometimes if the aneurysms, if the outpouchings have already formed, then you may need to be on blood thinners which are called anticoagulants, and they may have to be taken for a very long duration depending upon the disease condition. And all the children who had Kawasaki disease, they need to be on follow-up because they may have problems as an adolescent or an adult related to heart and its blood vessels. So every children who have been treated or who have been diagnosed with Kawasaki disease needs to be on a long-term follow-up. As I said, this disease follows an unknown viral infection. We have had cases similar to Kawasaki disease following even COVID infection called as MIS-C. These are very similar diseases following COVID. In children, COVID itself was not severe, in majority of children, but the response or the immune response to COVID resulted in a very similar disease called MIS-C. This is also similar immune response to COVID resulting in a Kawasaki disease like illness. So the take home message for parents is, whenever you have a child with fever who's not following a set protocol, the fever is persisting, the fever follows the second week, you need to visit the pediatrician properly and get assessed. Even if you have gone to the doctor, they have given you a treatment, if the child behaves in a different way, if there are different signs developing, then again we need to follow up with the doctor. This is the most important message, because fever is a very common condition, a very common symptom, but rarely this can result in serious complications like Kawasaki disease. If you found this video useful, if you found this message to be of use to others, kindly share it among your friends and relatives. If you want to watch similar videos, kindly subscribe to this channel. Till we meet again, bye.